Well, joining me and joining us right now is Dr. Ramesh Adalja, who's a senior scholar for Johns Hopkins Center for Health Security. Doctor, welcome and good morning to you. When you hear those new numbers out of New York City, are you concerned?
You have to remember that the virus hasn't gone anywhere. Even if you see hospitals not being stressed, even if you see a percent positivity falling, social interaction is inevitably going to increase cases. So the question always is not are you going to get new cases, but do you have the public health infrastructure to be able to keep the pace of those cases to something that hospitals and health departments can handle? And for New York, I'm much more confident in their ability because of how measured their reopening was and the metrics they tied everything to, having a certain amount of contact tracers. So I do think that they will probably become very vigilant about that uptick in cases, and hopefully New York won't have the kind of second coming that many other states did, for example, like Florida.
And what about that spike in the Midwest that we're seeing? I believe Minnesota, Montana, South Dakota, and Wisconsin reporting record increases. What's happening exactly in those particular areas?
It's usually multifactorial. Some of it may have to do with in-person university classrooms. That's what people initially suspected with Wisconsin, but there's more going on in Wisconsin than that. And I do think this is what we're going to see, is these hotspots kind of moving from place to place in areas who weren't hit very hard in March and April, where there is this quarantine fatigue, where you see activity starting to resume, and then you see cases. And the key thing is going to be in those states to make sure they have enough contact tracers, make sure that they're talking to the public about what common sense steps they can take in order to stop the virus from spreading. And I think this is what we're going to see until we have a vaccine, this kind of map moving from state to state as hotspots flare and then cool down and then flare somewhere else.
And Dr. Adalja, one thing that's so important that you said, the virus has not gone anywhere. So we saw yesterday's announcement of the president's Supreme Court pick at the Rose Garden. Few were wearing masks, although we should mention it's unclear if those people were tested. And then last night in Pennsylvania, the president held another rally. Many people are thinking that these are super spreader events. There's been some evidence of that in previous rallies. What do you think when you see these images that we're showing?
And we should point out one of those people not wearing a mask is the Health and Human Services Secretary, who's there also doing the fist bump.
Right.
So contact with folks and not wearing a mask. But I digress.
All of this sends very mixed messages. We are still in a pandemic. And while that doesn't mean that we have to stay at home or return to economic shutdowns, we have to behave using common sense measures. Wearing a face covering, trying to avoid mass gatherings, trying to avoid anything that's crowded or congregate, and just really behaving as if there is this virus out there that can spread and put our hospitals in crisis and kill vulnerable populations. And what you see is people not doing that. And I think that this is the result of the fact that this hasn't been taken seriously from the highest levels of government from January, that this was deliberately played down, and that has trickled into the general public's perception of this virus. And we are going to continue to get flare-ups like we're seeing in Wisconsin until people start to take this seriously and start to behave as if there's a pandemic and it's not about always staying at home. It's just about when you do go do things, just remember there's a virus there with you. And there are simple things to reduce the harm that this virus can cause, but only if you practice them.
It'll be curious to see if those 50,000 plus cases that we got from Friday was just an outlier or if it was a trend. We'll find out a little bit later on today. Dr. Ramesh Adalja, thank you.
Thank you.